All right, so are you ready to jump into some pretty interesting stuff today?
Always ready to dive in.
Okay, good, because we're going to be looking at those gig nursing apps.
Yeah, Clipboard and ShiftKey.
Clipboard and ShiftKey, exactly. So we've all heard of Uber, right?
Of course, yeah.
Like it totally revolutionized transportation. And these apps are kind of doing the same thing for healthcare.
Yeah, making it so nurses can just pick up shifts.
Pick up shifts whenever they want at all different facilities.
Which on the surface sounds amazing.
Right. Like who wouldn't want that kind of flexibility and potentially higher pay?
Yeah, and the freedom to choose where you work.
There's
always a but.
There's always a but.
Yeah.
The stuff we've been reading suggests there might be like a whole other side of this story.
Yeah.
Especially when it comes to, the impact on patients and nurses' rights.
Yeah, these are real issues.
Yeah, and it's not just like some abstract tech thing,
Right.
This is people's health.
People's livelihoods, yeah.
Yeah, exactly. So whether you've got a family member in a care facility or you're just interested in this whole, like, gig economy explosion.
Yeah.
I think this deep dive is going to be pretty eye-opening.
What strikes me is that this isn't just about technology. It's really a symptom of some bigger changes happening in healthcare right now.
Yeah.
Like we're talking a nursing shortage.
Right.
Burnout is through the roof.
Yeah.
Nurses are desperate for more flexibility.
They want to control their schedules.
Exactly. And these apps are tapping into those needs, but there are some serious downsides to consider.
Yeah. And speaking of tapping into needs, these apps are blowing up in popularity.
Oh, for sure.
And I think this one statistic really puts it in perspective. An estimated 100,000 nurses have left the profession since 2020.
Wow.
Yeah, it's crazy. No wonder these apps are getting like billions of dollars in valuations.
Yeah, the demand is huge, but those valuations don't tell the whole story.
Right.
We need to look at the human side of this.
Right, the actual people involved.
And that's where things get a little messy.
Okay, so let's get into it. One of the sources we've got focuses on this nurse, Shanika Howell, who decided to give Clipboard a try.
Yeah, she needed some extra income.
Yeah.
Gas prices were insane at the time.
Yeah, they were.
And she liked the flexibility.
Yeah, I can see why she'd be drawn to that.
But it didn't really go as planned.
Oh no, what happened?
Well, she ran into some serious issues with the app.
Okay.
For example, they have this really strict point system for attendance.
Oh, wow.
And she almost got suspended because she missed a shift confirmation.
Wait, so she missed a confirmation?
Well, she was driving to the shift.
So they were going to penalize her for showing up to work.
Pretty much.
Seems a little backwards.
Yeah, and that wasn't even the worst of it.
Oh, there's more.
There's more. One time she was assigned to care for 40 patients.
40 patients?
By herself.
That's insane. How is that even possible?
It's way beyond any reasonable nurse-to-patient ratio.
Yeah.
And she said she felt completely abandoned by the app.
Like they just threw her in the deep end.
Exactly.
And so this brings us to the big question.
What does this mean for the patients?
Right, because they're the ones who could really suffer.
Absolutely. You can't just plug and play nurses into these complex healthcare settings and expect everything to run smoothly.
Right. You need consistency.
Familiarity.
You need nurses who actually understand the patients and the protocols.
Exactly. And this Richard Mollett, who heads up the Long-Term Care Community Coalition,
Okay.
he's really outspoken about this.
Okay.
He argues that consistent care from nurses who know the patients and the facility is crucial for good outcomes.
So it's not just about having a body in a scrubs.
Right.
It's about having a skilled professional who's part of a team.
Exactly. Someone who's invested in the patient's well-being.
And we actually have a really disturbing example of what can happen when that consistency is missing.
Oh, yeah.
There was an incident at a nursing center in Corpus Christi where a resident was seriously injured because a ShiftKey aide left them unsupervised.
Oh, wow.
So the aide was helping a resident with mobility issues.
Okay.
And she got distracted by another patient.
Oh, geez.
Left the room for just a few minutes.
Oh.
And that resident ended up falling and fracturing their leg.
Oh, that's awful.
Yeah. And it just shows how those few minutes.
You make all the difference.
Yeah, in a setting like that.
Yeah.
But it sounds like there might be more to the story.
You're right. The aide actually said she hadn't received proper training from the facility on how to assist that particular resident.
So she wasn't properly trained and they just let her.
It raises a really troubling question.
Yeah, are these gig nursing apps inadvertently putting patients at risk?
Because the nurses or aides might not be adequately trained.
Right, or familiar with the procedures?
Exactly.
That's a scary thought.
And this Michelle Mahan from National Nurses United, she's extremely concerned about this whole trend.
Okay.
She argues that the gig work structure just doesn't incentivize thorough training.
Because why would a facility invest in training for a nurse who's only there for a few shifts?
Exactly. They're treating nurses like interchangeable parts.
Instead of investing in their development.
Exactly. And if nurses are constantly moving from one facility to the next,
Yeah.
how are they supposed to build that deep knowledge?
The experience that comes from working with the same patients and colleagues over time?
Right. It's a real concern. And we're actually seeing evidence of this in reports from CMS. The Centers for Medicare and Medicaid Services.
Okay, so CMS is the federal agency that oversees a lot of healthcare facilities.
A huge chunk of them, yeah.
And their reports carry a lot of weight.
Oh, yeah. Facilities definitely pay attention when CMS flags problems.
So what are they finding?
They're issuing more and more citations for training deficiencies.
At facilities that use these gig nursing apps.
Exactly.
Yeah.
It suggests they're starting to recognize the risks.
It's like a wake-up call.
Yeah, this convenient cost-cutting solution.
Might be coming at the expense of patient safety. But even beyond those immediate risks, there's this whole other issue of nurses' rights as workers.
Absolutely.
They're not getting the same benefits and protections as traditional employees.
That's a crucial point, and it's something we need to delve into further.
So we were talking about these gig nursing apps and how they might be kind of putting patients at risk.
Yeah, and we can't forget about the nurses themselves.
Right. Like, it's easy to get caught up in the whole tech side of it.
The convenience.
The on-demand aspect.
But these are real people with real careers.
Yeah, and the way these apps work, it raises some big questions about worker classification.
Are they really independent contractors?
Or are they basically employees with a different label?
Yeah, that distinction makes a huge difference when it comes to benefits and protections.
Like, are they even able to stand up for themselves if something goes wrong?
It's a really important point. You know, we hear so much about the flexibility of gig work.
Yeah.
And the earning potential.
Right. Make your own schedule. Be your own boss.
But we don't always talk about what you give up for that freedom.
The trade-offs.
And in nursing, those trade-offs can be pretty serious.
Like what kinds of things?
Well, for one thing, nurses working through these apps usually don't get the benefits that come with a traditional job.
Okay, so things like health insurance,
paid time out,
retirement contributions.
All the stuff that most people just expect to have.
Right, but that are crucial for financial security.
Especially in a demanding job like nursing.
Yeah, it's not like you could just take a mental health day.
Yeah.
When you're dealing with life or death situations.
Right, and then there's the issue of malpractice insurance.
Oh, yeah. In a hospital or clinic, the employer would usually cover that.
Right, but with these apps, it's not always guaranteed.
So nurses might have to pay for their own coverage.
Yeah, on top of everything else.
Which really eats into their earnings.
Exactly. It's a double whammy, and it's not just about the money either.
Okay, so what else is there?
There's the whole issue of professional development. You know, in a traditional setting, nurses have opportunities for training,
mentorship,
career advancement.
But with these apps, it's more like you're on your own.
Sink or swim.
Yeah, you pick up a shift, do the work, and then you're gone.
And that makes it hard to build expertise.
Yeah, to specialize in a certain area.
Exactly, and it goes back to that question of worker classification.
Are they really independent if they're not really in control of their careers?
That's what this guy Dane Stephenson argues.
Who's Dane Stephenson?
He's a former lawyer with the Department of Labor.
Okay.
And he says that a lot of these nurses working as independent contractors don't actually fit the legal definition of running their own business.
Because of the nature of nursing.
Right. It's not like they're setting their own rates.
Or marketing their services.
They're filling a need within a system.
They're more like cogs in a machine.
Yeah. And the Department of Labor is starting to take notice.
Really? So they're actually doing something about this.
They've already gone after some staffing agencies that were misclassifying nurses.
And not paying them overtime.
Exactly. So there's definitely some recognition that this is a problem.
That these apps are operating in a bit of a gray area.
For sure. But it's a complicated issue with a lot of different players involved.
Yeah, you've got state laws,
federal regulations,
court cases,
lobbying from both sides.
It's a mess.
It's a tangled web, and while all of that gets sorted out,
the nurses are stuck in the middle,
trying to make a living
and provide care
under these really uncertain conditions.
It's not a good situation. And it makes you wonder about the gig economy as a whole.
Right. Is this model sustainable?
Especially for essential services like healthcare.
Are we sacrificing quality and worker protections for the sake of convenience?
And what does this mean for the future of nursing?
If this trend keeps going, will it become even harder for nurses to advocate for themselves?
To fight for better working conditions.
Michelle Mahan from National Nurses United, she's really worried about this.
Yeah.
She says that this whole gig structure makes it almost impossible for nurses to organize.
to build that collective power that you need to make real change.
Exactly, because they're constantly moving around.
They don't have that shared experience.
That sense of camaraderie.
It's like the gig economy is designed to keep workers isolated.
To prevent them from forming unions.
And if nurses don't have a voice?
It affects the quality of care that patients receive.
It's all connected, isn't it?
Absolutely. The way we treat our healthcare workers directly impacts the care that we all get.
So it's not just a worker issue.
It's a societal issue.
They all have a stake in that.
And that's something we need to remember as we try to figure out how to navigate this whole new world of on-demand healthcare.
But before we get too philosophical, let's talk about what's actually being done to address these concerns.
Yeah, are there any laws or regulations in place to protect these nurses?
And to make sure patients are safe?
That's a good question, and it's one we'll explore right after this.
Okay, so we've been talking about all these problems with gig nursing apps. But it sounds like people are starting to try to do something about it, right?
Yeah. It's not like the Wild West out there.
So what's happening? Like, what are the big things people should know about?
Well, one of the biggest fights is about worker classification. You know?
Like, are these nurses really independent contractors, or are they employees?
Exactly, because that changes everything when it comes to things like minimum wage and overtime and all those basic protections.
So are there, like, actual lawsuits happening? Are people trying to get these companies to change how they classify workers?
Oh, yeah. There are tons of lawsuits and even new laws being proposed all over the place.
So what makes nursing different from other gig work? Like, why should nurses be treated differently than, say, an Uber driver?
Well, I mean, for one thing, nursing is a highly skilled profession.
Yeah, you have to go to school for that.
Years of school and specialized training, and you need a license to practice.
That's not something you just pick up overnight.
Definitely not. And it's not like you're just driving someone around or delivering a pizza.
Right. You're dealing with people's health.
Their lives, even.
There's a huge amount of responsibility involved.
And another big difference is that nurses are usually working within a larger healthcare system.
Right. They're not just out there on their own.
They have to follow all these protocols and use specialized equipment and work with other medical professionals.
It's a much more complex job.
Yeah, it's not really comparable to other gig work.
So are any of these lawsuits actually working, or things starting to change?
It's still kind of early, but there have been some wins.
Like what?
Well, for example, California passed this law a few years ago called AB 5.
Okay.
And it made it way harder for companies to call workers independent contractors.
California's leading the way as usual.
They often do when it comes to workers' rights, and other states are starting to follow suit.
So things are moving in the right direction.
I think so, but of course the gig companies are fighting back.
I bet they don't want to give up their profits.
They have a lot of money and power, and they're spending it on lobbyists to try to stop these changes.
What do they say? Like, what's their argument?
They say that reclassifying workers would stifle innovation and make everything more expensive and limit flexibility.
It's like the same arguments they always use.
Pretty much, but, there's another side to that story.
Yeah, the workers deserve basic protections.
And the patients deserve quality care.
It's like we're all stuck in the middle.
Trying to figure out how to balance all these competing interests.
Yeah, it's a tough situation, and it makes you think about the future of work in general.
Yeah, is this gig economy model really sustainable?
Especially when it comes to essential services like healthcare.
We're kind of in uncharted territory here.
And speaking of healthcare, what about patient safety? Are there any rules in place to make sure these gig nurses are actually qualified?
Well, like we mentioned before, CMS has been cracking down on facilities that aren't properly training their staff.
So they are doing something.
Yeah, and those citations they issue can have real consequences.
So facilities have to take them seriously.
Yeah, they don't want to lose their funding.
But is that enough? I mean, are those citations actually making a difference?
It's hard to say for sure. It's still kind of a cat and mouse game.
Yeah, these apps are constantly changing.
And the regulators are always playing catch up.
But at least people are starting to pay attention.
That's the first step.
So what can our listeners do? Like, how can they get involved?
I think the most important thing is to stay informed.
Yeah, do your research.
And don't be afraid to ask questions.
Demand answers.
Hold these companies accountable.
Because this isn't just some abstract issue.
It affects all of us.
It affects our health,
our families,
our communities.
We need to make sure that this technology is being used responsibly.
That it's actually benefiting people.
Not just making a few people rich.
I think this has been a really important conversation.
Yeah, it's a complex issue.
But I think we've given our listeners a good starting point.
A lot to think about.
So thanks for joining us, and keep asking those tough questions.
And stay engaged. This is a conversation that's just getting started.